Welcome to today's episode of Think Podcast. And today, my guest is Elise Marone. She is an RD, LDN, CGP, and she functions as an integrative and functionally trained dietitian, nutritionist specializing in digestive health, metabolic disorders, autoimmunity, and chronic disease reversal. A certified gluten-free practitioner with advanced training from the Institute of Functional Medicine and the American Academy of Anti-Aging Medicine. She combines science-based nutrition with a holistic approach to healing. Her practice is based in Palm Beach Gardens, Florida, and she maintains a private practice and serves as a national lecturer and consultant to healthcare practitioners, such as me, on clinical nutrition, laboratory testing, lifestyle medicine, and therapeutic supplementation. Her mission is to help people identify the root cause of their health issues, restore balance, and live vibrant, healthy lives. So let's dive into today's topic, which is going to be food sensitivity testing, specifically the food testing done by Vitae Laboratories. I've been using this lab for my own patients, and I've been seeing, more detailed reports. So I'm going to have Elise discuss the difference between this test and traditional food allergy testing, and basically have her just jump in and kind of explain the importance of why we use food sensitivity testing. Go ahead. Welcome.
Okay, great. Thanks, Wendy. Thank you. So the Vitae, it's called the E144, and that's because it's testing 144 different antigens, and it tests each antigen for 4 markers. So it's not just food sensitivity, it's also food allergy because we're looking at IgE. And if we have IgE present, we know that it's breaking down your mast cells, degranulation is occurring, and we're seeing a release of histamine. So we want to catch that because that could then lead to very serious issues,
Oy.
including death. Then we also look at the IgG4. So IgG4, which is a subclass antibody of IgG, it's important to look at that because it's actually showing how the immune system is working. So low to moderate levels of IgG4 is good. It's blocking the IgE molecule from adhering to the receptor site because IgG4 is the same size molecule and it competes for that receptor. So you'll get a less severe IgE reaction. But the problem with IgG4 is if it's high, then we look at, well, what's that doing? Because there's IgG4 related diseases, and those tend to be pretty serious as well, like autoimmune diseases, skin, thyroid issues, skin conditions, hair loss, things like that. So that's a problem we see in a lot of our patients. So we want that information. And most tests are not doing that. Your traditional labs don't
They
tend
come
to
in
test
and they say, a lot of
IgG4.
patients, I did a food allergy test with my doctor and, they show me their results and they're always showing IgE. And what you're saying is you could have an IgE reaction, but you have another immune pathway that is actually blocking that IgE from actually doing damage. So in those cases, you probably can, would you say, tolerate some of that food safely without having to eliminate it completely?
Maybe. On a case-by-case basis, we'd have to see what's going on with the patient as a whole. We're going to look at their overall pictures, their overall symptoms, and look at the amount of inflammatory reactions they're having. If the patient has IgE, but then they also have IgG4, low to moderate, there is some protection for the patient from IgE.
So that is different than what we're seeing by just measuring an IgE, which I think is valuable because patients will assume that they're allergic completely to it, and that's not the whole story. And I like what you said about the symptoms like eczema, and people often don't correlate non-GI symptoms with having a food sensitivity. Things like, let's say,
Exactly.
like migraines, besides skin issues, mood disorders, things that aren't directly like constipation, diarrhea, bloating, reflux. There's so many extra gut symptoms that really are related to food sensitivities. Do you want to talk more about some of those?
Yeah. So, the gut is, right, the second brain. We call it the second brain. There's more serotonin in the gut than in the brain, which is a neurotransmitter. So anything that's going on in the gut that causes inflammation, which food allergies and food sensitivities definitely do, is going to affect the brain. So that patient who comes in with brain fog, memory loss, sleep disorders, anxiety, depression, they need to be looked at for food allergy sensitivity because there's probably a role that's being
And what
played with
patient
that.
doesn't have? So
Um,
one of I mean, this is why I really love to start with this test with my patients, and I like that insurance covers it a lot, and, it's so easy to do. They have that self sucky thing that you can put on your arm, and I just think when you're
yeah.
evaluating a new patient for whatever symptoms, it's really important to get a good foundation using this test because I think and you can explain besides the brain and mood, right? We're in this new time of GLPs and everyone wants to lose weight, but one of the main reasons why people have weight gain and they can't lose it is because they're inflamed and the inflammation is coming from their gut, which is affecting their immune system. And so if you don't treat the immune system by treating the foods and you'll lose weight, but you're not treating anything, right?
Yeah. It's like there's water coming into your boat and you're using a bucket and you're trying to get the water out of your boat, right? So, yes. And also with the GLP-1s, you want to make sure your gut is healthy because part of how they work is they slow down gastric emptying, right? And then that can lead to issues with your microflora, your microbiome, the little bugs that are living in there. And that can lead to problems that are really hard to work on down the road, like small intestinal bacteria overgrowth and H. pylori and things like that. So for sure, anybody who eats, in my opinion, needs to know what their foods are that they're reacting to. So I do this test on pretty much every single patient as well. So after we look at the IgG4, that kind of gives us an insight other if is there something that we need to avoid if they have an autoimmune disease and their IgG4 is high. I want to know what foods are causing that. And if they're family history with an autoimmune, we want to make sure we have that information as well. But also, that could be the patient where we haven't been able to figure out what's on, right? Because it's, they have a migraine and we can't figure it out. It's not hormonal, it's not chemical.
All in their head that they have an intolerance or a sensitivity. And besides the IgG4, doesn't the Vitae measure an additional marker that is when it's really high, if the complement part, which that's the one that really can cause autoimmunity, right? Can you talk about that marker?
Well, so we have it does 4 markers. So it does IgE, IgG4, IgG, and complement factor C3bD. So IgG is going to go up when you have exposure intolerance. So that's where a lot of doctors will be like, "Oh, of course it's high. It's what you're eating." But your body's not supposed to be reacting to protein. So if we see a patient with a lot of IgG, so 5 or more foods that are high IgG, that is not just, "Oh, well, that's what you're eating. Yes, that makes sense." It's what you're eating, and it's also what you're presenting to the immune system. So in that case, your immune system is doing what it should do because it's not supposed to see food. So it says, "What is this?" And it makes an antibody. And now you're reacting to your foods. Our foods, you know what? We look a lot like food. To certain things, we are food, right? So when we make those antibodies to foods, sometimes the antibodies look a lot like our own tissue. And that's when you'll start to see there may be some confusion and autoimmunity being initiated or exacerbated by having these IgGs. So your body will now start attacking the thyroid because that maybe looks a lot like pork. So we want to make sure that the patient is not making a lot of IgGs. And if they are, we want to fix their gut. If the gut is perfect, which nobody's is, but let's pretend it's perfect, it's going to have a very small amount of permeability. The size of the um, the holes, if you will, that are allowed to come through shouldn't be much bigger than a glucose molecule or an amino acid
It's
or a
small.
simple sugar molecule. But when we see inflammation in the gut, when we see, some of the medications that people are taking, it causes an increase in the size of that permeability. And in the functional integrative space, we call that leaky gut, which is just an increase in gastrointestinal permeability. So when you see a lot of IgG, we know that that patient has an increase in leaky
Yes,
gut
because then
and
you see the patients lighting up to
gastropermeability.
almost every food on the test, and you know that person has leaky gut.
Mhm.
And then behind the leaky gut, yeah, there's medications and exposures and toxins, but the stress and the cortisol and the amount of sympathetic overdrive that we're in Can you talk more about like how the cortisol and the affects the leaky gut and how the gut becomes permeable and then that leads to the next process, which is what we have more insulin, and then we have insulin resistance, and therein is the weight gain, right? And so we could talk about foods, but it's also in stressors, right? That load that we're all, work stress, family stress.
Well, it's a cascade of events that happen, right? So the main thing we're looking at when we look at food allergy sensitivity is the immune response to foods, inflammatory response to foods, and each one, depending on what's happening, is different. That's why we want to look at all the markers. So you did mention complement factor, and I'll get to the cortisol question, but
Yes,
first I want to
please.
just talk about the complement factor. So C3BD, we measure that because when C3BD is elevated to a food, it's basically floating around looking for IgG to that food. When it sees IgG to that food, think of it as it binds it and makes this immune complex, then tries to explode it. And that causes an increase in inflammation and can exacerbate symptoms up to 10,000
Wow.
fold. So if you have complement factor and you have IgG, you do not want to be increasing IgG to that food. And the way to decrease it is we fix the gut and we remove the food for a period of time until we can clear it. And then we can start adding these foods back. So that's the beauty of it. It's not forever. It's like you see your results and they're like, oh, there's nothing I can eat. It's like, well, there's plenty you can eat. And yes, you're going to stay off of these foods for 3 to 6 months. And then we're going to retest and hopefully be able to reintroduce it after we remove the foods and we repair the gut and we fix your probiotics and your gut lining and
Mhm.
things like that. But anytime you're increasing inflammation in the body, that will cause the body to increase cortisol, which then causes an increase in fat storage in the central adiposity or the belly fat, which is also inflammatory. So it creates this cyclical
Yeah.
issue. And then also, people are stress eaters. So there's an emotional component to it as well. And you could be feeling stress and anxiety because you're reacting to a
And it's
food.
delayed,
So
right?
now
It could
you're
be
having a
delayed, so you don't
physical.
even know what food it is until, like, you're like, "Oh, I ate pizza 2
It can
days
take up
ago."
to 72 hours. hmm Yeah, up to 72 hours. So you may not be able to figure out just by process of elimination what food you're
It's really
reacting to.
interesting.
So that's why we like to,
Yeah, how, like, the food how something so simple as
yeah.
a food sensitivity intolerance can lead to the accumulation of deep fat, which we call visceral fat, which is inflammatory, right? Which then affects
hmm
the fat cells, which we and the hormones that the fat cells make. They're called adipokines. We hear leptin and we hear all these other, hormones that the fat cell is now secreting, which increases resistance, to inflammation. So now we're just like you say, it's this cascade of events, and the simple solution is just test food sensitivities and remove the triggers because I really it's one of the most frustrating parts of what I do is just explaining that the body, when it's inflamed, can't be metabolically efficient. So, in order for you to be metabolically
Right.
efficient and make clean energy and have brain, focus and clarity, we have to. I mean, no one's perfect, and there's no perfect scenario. But if you keep pushing on the pedal of inflammation, it's never going to improve. So, um,
Yeah. It's like, the Sydney Baker term, where if you have a nail in your foot,
yeah,
we can give you all kinds of pain medication, but you're really not going to resolve the issue until you take that nail out of the foot. And even if we can give you pain medication, you're probably going to get an
right.
infection. And that's going to lead to more inflammation. So we really need to take the nail out of the foot. In this case, we're talking about food allergies and sensitivities. We want to remove that
Yes, and
food.
I also found it interesting on the test, the Vitae test, how they some things that you just don't see on the other ones. Some of the dyes it tests the different proteins in the dairy. So if you want to talk a little bit more how it stands
Mhm.
out, because it's a little bit more specific in what it actually tests for, so people can actually be intentional. Because some people just avoid, like, I get a common question all the time about, the cholesterol that I use, and it's dairy derived, and people think that it's the same as having a lactose, so it's like, no, this isn't always
Right.
true.
So,
Let's talk about that.
yeah. So that's a couple
Okay.
different questions. So as far as the colostrum, yes, it does come from dairy. It does contain dairy, but colostrum is really cool. because it can fix a dairy allergy, even though it is dairy. So when you think of colostrum, it's magical. It's the mother's milk the first 3 days. It what sets you up for having your immune system for the rest of your life. So big advocate for breastfeeding because of colostrum. If you were not a breastfed or you weren't able to breastfeed your child, then your colostrum, actually all colostrum really looks the same to the immune system. So your colostrum would be like giving colostrum from human colostrum, even though it is bovine. So we do, unless they're anaphylactic to dairy, we will use colostrum in many patients. The other question that you had asked about, is it's not an intolerance. So there's food intolerances. So a lactose intolerance is the sugar to the dairy that your body cannot break down. Most adults can't break down lactose. So we lack the enzyme lactase, which breaks lactose down. So really, most of us can't. Some of us are worse than others, and you have a lactose intolerant because every time you eat dairy, you have a GI effect from it. That's not what we're measuring here. What we measure here, we're actually looking more at the proteins. And is your body reacting and making an antibody to that protein or releasing histamine in the event of an IgE? Why I like this test and how it's different is that they actually block the antigen carbohydrate portion. So it's CCD in the antigen. That is blocked. So they're only looking at true IgE allergy. Most other companies, they don't do that. They don't even know to do that. So you may see an IgE that comes back and it's positive, but it's actually a cross reaction with the carbohydrate. And doesn't make sense because the patient really doesn't have to avoid it. They also, like you were mentioning, they take out the recombinant proteins. So when you look at the antigen from an apple, that has a lot of different things in it. So it's not just protein. It's not a very protein dense food. So they're pulling that protein out, concentrating it and testing that along with the whole apple antigen, because you may be able to eat a bite of an apple, but you won't get that much protein and your body won't react. But if you eat the whole apple, which most people don't just take a bite of an apple, right? They're going to eat the whole apple, they would react. So most of those other tests on the market would miss that because they're not pulling that protein out into its components.
That's so
of
intelligent.
the apple.
That's really intelligent.
Yeah,
I love that.
Yeah. So we're catching that. So we're finding things that other
And I'm
labs
sure
are
they're
missing
just
for sure.
continuing to expand their testing because we're seeing so much more, preservatives and food, things that are adding to our food chain that, again, our immune systems don't know what they are. And so they think it looks like us. And then, like you said, that could lead to more autoimmunity. And something else I see, separate from the Vitae test, is when I do stool testing, it measures what's called secretory IgA, which is the immunoglobulin, right? That's surveying some of the food and helping our guts decipher what's foreign and what's, not. And I really almost always see it so low. I just think that whether you have, everybody's gut immune axis is being affected by today's, food chain, whether you eat clean or not, I think, in some respect. So I always see that.
Hard.
Yeah.
Yeah. The
Yeah.
pesticides that are here forever now, the glyphosate, Roundup, it's in everything. It's in our groundwater. So even things that are organically
Yeah.
grown, we just guarantee that there's not going to be any glyphosates or anything in them anymore. So
Well, we
you can only do the best that you
So
can
now that
do.
we have this test, we get these results, and we go over it, with our patients and our clients. How do you describe to me your steps for how you, counsel to make it more, not as restricted? How do you go about guiding your patients
Yeah.
and following what the results tell them to do? Like, what is your approach?
So this test is easy because it gives you the red, yellow, and green, right? So red means stop, yellow means slow, green means go. So they really simplified it. What I do with the patient is I said, here's your green list. This is your shopping list. Everything in here you can eat. The red list, we're going to remove those foods for 3 to 6 months. We'll retest and usually we can start adding things back in. The yellow list depends on symptoms. So if they are severely experiencing symptoms, I probably will also remove the yellow list. If they're mild symptoms, I may rotate it so they can have it once every 3 days, or just take or leave it in and just not worry about it and see, because the ones that are really causing the symptoms are going to be what's on that
Right.
red list. So I remove the foods that they're reacting to. Then I will do a repair phase. So I'll use like the colostrum,
This
some
the immune GI protect.
yeah,
Okay.
yep, it's colostrum base. So I'll use that to fix the gut. Sometimes I'll use glutamine allodeglyceride licorice. I think you have a formula for that. Do you have a glutamine formula?
Yeah, glutamine. It's in your glutamend that you have, the Numedica, right? The
Yep. So we'll do a repair phase. So the colostrum is great for that. Glutamine, allodeglyceride licorice, arabinogalactin. We want to also, and the other thing this tests for is candida reactions. So if your body it's going to have candida, but you're not supposed to make antibodies to it. So that's what we're looking at. Is your body reacting to candida? And if it is, then we want to address that. So for that, we'll use different herbs and things to reduce the amount of candida that the body is seeing. We may be looking at mold, and then we will address that. So we're going to remove the things that are affecting the immune
people always say
system.
that when their test
And
comes
then
back positive for the candida, they're like, "But I don't eat yeast. I mean, where am I getting?" I'm like, your gut's making
well,
it. It's producing it, and then you're creating an immune reaction to it because you're not your
right.
microbial balance is off. They're like, "Oh, okay,
It's a
yeah,
normal part of the gut flora. You have candida. We all do. The problem isn't that you have candida, it's that you're reacting to it. And you're reacting to something that, I mean, maybe you had an overgrowth of candida at one time and your body started having an immune reaction to it, or maybe you're just really sensitive to candida. So we want to keep it very low because you're just one of those people that reacts to it. And those people do
yeah."
not feel good. So high candida antibodies, you're going to see that patient's going to be brain fog, pushing their thoughts through jello. It's not going to be that,
And yeah,
energetic
and they're the
patient.
ones
They're
that
going to feel
honestly, when
horrible.
I bring back my derm days, they're always the ones that have the flaky scalps, the oily, greasy skin. They're the ones that have acne. Let's talk about acne in this, in the gut. Because they're feeding this candida, and the candida is creating all this, I mean, histamine and immune reactions, which is creating the permeability, right? And then the skin becomes that
Mhm.
depot of where it all lands. So yeah, I mean, the skin is a sign a lot of times of what's going on in your gut, and that's what brought me actually to functional medicine was my time in derm and seeing so much acne and dermatitis and psoriasis and, you know, and not yeah.
Well, yeah, like we say, like we're made like a donut, right? What's
Yep.
going on the inside is coming out, and you're going to see it on the outside. So if somebody has eczema, what's
Yeah.
going on in their gut?
What's going on in your
It's
gut,
like
right? I
that.
mean, I mean, listen, I think that it's a simple way to really assess what might be driving inflammation, which anything, we now know that most diseases are inflammation. Cardiovascular disease is inflammation caused by immune activation. We know that even mental health issues, so many people get put on all kinds of antidepressants when it's inflammation and immune and the leaky gut, leaky brain connection. And so I think why not treat what you can before obviously this is such a it's like a spotlight in what I do because obviously we're trying to treat root causes, but part of it is just clearing out the debris so that we can get to the root cause. And sometimes this is just extra debris that we have to like clear away so that we can actually figure out what's left that we need to really address. I mean, wouldn't you agree that that's kind of yeah,
It's core. This
yeah.
is core. Everybody eats, right? And so I say, well, what patients should you test? Anyone who
Anyone.
eats.
I want to
Yeah.
let the listeners know how they can reach you, and if they want, if any of the listeners are interested in doing this test, I do offer this test, and It's simple, like I said, it's 1 vial of blood, you can do it at home, you can it's a self-administered test. The results are pretty quick, the turnaround time is under, what, 10 days? Yes,
10 business
and
days, yeah.
then if you to interpret this, I work with Elise closely, and we can really team up and get you on the right, protocol to help you lower any inflammation in your gut, and then we can, you know, move towards again what else you can do, because once this is cleared out of the way, then we may not even need GLPs, you may not need all these things because the inflammation's down. And do you want to tell them how they
Right.
can reach you if they want to reach out to you directly?
Sure. Yep, you can go on my website, which is thenutritioninstitute.org, or my phone, which is 561-252-7857. And I do have some podcasts on my website as well.
Till next time.